Hi everyone, my name is Irene Manalastas, and this summer I got the chance to work with Dr. Catherine Rebel to look at white matter microstructure and neurodevelopmental outcomes in young children with prenatal alcohol exposure. So what is prenatal alcohol exposure, or PAE? So PAE is when the mother drinks during pregnancy, and this alcohol crosses the blood-brain barrier, which could then disrupt fetal development, and this can manifest as neurodevelopmental impairment, including neurocognitive, behavioral, and adaptive functioning. There's also been studies that show differences in white matter microstructure in the PAE population, where white matter is affected as seen by higher mean diffusivity in older populations with PAE and lower MD in younger populations with PAE compared to the controls. MD, or mean diffusivity, is just a parameter of diffuse tensor imaging that measures myelination, axon density, and axon diameter. And one thing to note with mean diffusivity is it tends to decrease with age. There has been previous studies on PAE, white matter, and neurodevelopmental outcomes. However, there are still limited studies on the effects of PAE on these neurodevelopmental outcomes, especially in early childhood. And this is an important time because studies show that early childhood is a period of rapid brain development. It is also when challenges in behavior, executive, and adaptive functioning start to develop. Thus, early interventions can be critical to identify and address challenges in these neurodevelopmental outcomes. Which brings me to the aims and hypothesis of this study. Our first aim was to investigate differences in neurodevelopmental outcomes in preschool children with and without PAE, and we hypothesized that the PAE group will have worse scores than the control group. For our second aim, it was to investigate white matter microstructure associations with neurodevelopmental outcomes in preschool children with and without PAE, and our hypothesis was that the PAE group will have different associations compared to the control group. For our methods, we had 51 kids with PAE and 53 controls with an average age of about 5 years old. For our MRI, the TTI scans were acquired at the Alberta Children's Hospital, and MD was calculated for the SLF, or the superior longitudinal fasciculus, which has been known to affect behavior, executive, and adaptive functioning. For our neurodevelopmental outcome scores, we looked at parent-rated reports. And for statistical analysis, we use ANOVA models, and these were the models that were used as stated here. For results, we begin with executive functioning. So we can see here that the PAE group had worse scores compared to the controls, demonstrating that they had worse executive functioning. And for relationships with behavior, there was a significant group-brain interaction for executive functioning, where in the PAE group, scores were negatively correlated with MD, but not in controls. For behavior, again, we found that the PAE group had worse scores compared to the controls, again, demonstrating that they had worse behavior. And again, we also found a significant group-brain interaction for behavior, where in the PAE group, scores were negatively correlated with MD, but not in controls. Lastly, for adaptive functioning, we also found that the PAE group had lower scores compared to controls, indicating worse adaptive skills. And again, there's significant group-brain interaction for adaptive skill score, where in the PAE group, scores were positively correlated with MD, but not in controls. Overall, our results show that children with PAE have worse behavioral, executive, and adaptive functioning. This does align with previous research in older children and reiterates the importance of timely identification and interventions for these impairments. Clinically significant and at-risk scores emphasizes the need for interventions, especially within these domains. For the interactions, there was a significant group-brain interaction for adaptive, overall behavior, and shift scores, where in the PAE group, scores were negatively or positively correlated with MD, but not in controls. These differences in brain behavior associations likely reflect disruptions to brain development caused by PAE. Overall, findings show different neurodevelopmental and white matter profiles in children with and without PAE. It highlights the need to consider the effects of PAE on neurodevelopmental outcomes in preschool children and the creation of timely identification and interventions for these impairments. Thank you for taking the time to listen to my presentation. Here are the acknowledgements who has helped me with this research project. Thank you.